So, indications, syempre, cardiovascular diseases such as the following, and syempre, you have your hypertension. And you have here yung mga cases of angina. So, yung mga conditions that are due to a decrease in the oxygen supply. So, wait lang guys. Okay, so resume tayo. So, diltiazem, this is a calcium ion influx inhibitor. So, it also inhibits, syempre, pa rin yung influx of calcium towards your cardiac muscle. So, ang overall result is to decrease the contractility of the heart. So, pag titignan nyo, yung mode of action naman, syempre, will be in general nyo na i-memorize. So, calcium channel blocker, it will block or it will decrease your intracellular calcium in your cardiac muscle. So, indications, you have hypertension and angina. So, adverse effect na important with your diltiazem is your gingival hyperplasia. So, take note nyo yung mga side effects na yun na yellow ko. Kasi yun yung mga common na oral side effect na pwede nyo ma-observe in your patient. So, pwede kayo kasing maka-encounter ng patient complaining of gingival hyperplasia. Upon history taking, nagtitake pala yung patient nyo ng diltiazem. So, most probably, yung cause ng gingival hyperplasia niya is due to your diltiazem. So, what you will do is syempre to stop the diltiazem. Yeah, so, take note of the important oral side effects. So, nifedipine, yan, it causes coronary vasodilation, hence increasing coronary blood flow. But take note, it causes reflex tachycardia. So, when you say reflex tachycardia, biglang mag-e-elevate yung heart rate ng patient. So, nagdi-decrease nga yung blood pressure, pero pag chinek nyo yung heart rate elevated. So, indication, pag titignan yung indication, still angina and some of your cardiovascular disorders, pero yung important is your angina and hypertension. Ito ang madalas na pine-prescribe na calcium channel blocker, your amlodipine. So, usually binibigay yan together with an angiotensin antagonist like your losartan. So, losartan plus amlodipine. So, amlodipine, this is a long-acting calcium channel blocker that inhibits the influx of calcium again, thereby decreasing contractility of your cardiac muscles. So, indication used for hypertension in cases of angina pectoris. So, ito yung common na pina-prescribe, your amlodipine. Yan. So, yun lang naman yung mga important na calcium channel blockers natin. So, familiarize yourselves lang. You have your amlodipine, nifedipine, diltiazem, verapamil. So, mas madaling i-memorize yung mga beta blocker kasi pare-parehas lang sila ng pangalan. So, direct vasodilators naman tayo. So, when you say direct vasodilator, it will cause vasodilation doon directly sa blood vessel or doon sa blood vessel ng muscle. So here you have your hydralazine. So hydralazine, it acts directly on the arteriolar smooth muscles to cause relaxation. It will decrease the diastolic pressure more compared with your systolic blood pressure. So yung action niya is more on the diastolic pressure. So indication, you have moderate or severe hypertension and hypertension with involvement of the kidneys, your hydralazine. So another direct vasodilator is your sodium nitroprusside. So for sodium nitroprusside, it relaxes directly arteriolar and venous smooth muscle. So it will decrease both the preload and afterload. So magdi-decrease yung preload, yung pressure dun sa ng blood dun sa heart before and after. So yung pag-pump ng heart natin, causing now a decrease in the peripheral resistance. Yan. So for indication, it is used in cases of hypertensive crisis. So yung mga patients with very elevated BP, lalo yung mga may 200 over 150 blood pressure, yung mga ganon, pwede kang gumamit ng direct vasodilator kasi it will immediately vasodilate the blood vessels. Yan. So, important correlations with dentistry will be drug interactions. So, drug interaction. So, take note, aspirin and other NSAIDs antagonizes many antihypertensive drugs. Yan. So, here, ibig sabihin yan, when you are prescribing your aspirin or your NSAIDs, i-history taking nyo muna yung patients nyo, lalo for hypertensive patients. Kasi some of your NSAIDs and aspirin will antagonize the action of your antihypertensive drug. So mamaya, hindi nyo na history yung patient nyo. Nagtitake pala ng ACE inhibitors, ARBs, ganyan. Tapos prescribe ka ng aspirin or yan. So, nag-complain na yung patient ng poor control of their blood pressure. Yun pala, ina-antagonize na nung prescribe yung analgesic, yung antihypertensive drug nila. So, very important is your history taking. So, effect of diuretics are inhibited by your NSAIDs. So, kunwari yung patient nyo is on diuretics, your patient has congestive failure, for example, congestive heart failure. So, kadalasan kailangan nila diuretics to prevent formation of edema. Edema sa lungs, ganyan. Tapos, nag-prescribe kayo ng NSAID. Yun pala, na-inhibit yung effect ng diuretics. So, nagkaroon ulit ng edema formation yung patient or formation of effusion, ganyan. So take note, NSAIDs also reduces the antihypertensive effect of your beta blockers, so yung mga olols. So take note always of the drugs of your patient, especially for hypertensive patients na magpapakonsult sa inyo or may gagawan kayo ng procedure. So take note of their medicines, kung ano yung mga pwedeng mag-cause ng reduction ng effect ng drugs nila. So, pag ganyan, pili kayo ng other drugs na pwede nyo gamitin din sa patient nyo. So, na-discuss naman na natin yung mga analgesics. So, drug interactions. This interaction apparently results from the inhibitory effect of chronic NSAID therapy. So, meaning ng chronic NSAID therapy is use of NSAIDs more than 5 days. So, nagkakaroon siya ng effect on your prostaglandin synthesis. So, prostaglandins are very important in maintaining renal blood flow and urine output. So, kaya siya nagkakaroon ng effect kasi it inhibits your prostaglandin synthesis. So in general, the use of vasoconstrictors in local anesthesia is not contraindicated in hypertensive patients, especially in patients whose blood pressure is well controlled. Exception will be patients receiving an adrenergic neuron blocking or adrenergic neuron depleting drugs like your guanethidine or non-selective beta adrenergic receptors like your propranolol. So take note of the drug interactions. So here in judicious use of sympathomimetic amine vasoconstrictors in local anesthetic solutions could possibly lead to serious disturbances of blood pressure and cardiac rhythm. So kaya very important na i-take note nyo yung mga drugs na tinitake ng patient nyo, lalo if you are to use local anesthetics. So to avoid potential complications, the blood pressure of a patient on any of this medication should be taken before and 5 minutes after injection of a small amount of local anesthetic. So, kunwari, gagamit kayo ng 2% lidocaine with 1:100,000 epinephrine. Syempre, ang gagawin nyo is for them to take their medications before and 5 minutes after you inject your local anesthetic to prevent disturbances with the blood pressure and cardiac rhythm of your patient. Yan. So, yun yung mga iti-take note nyo pag gagamit kayo ng local anesthetic kasi it can cause problems with or fluctuations with your blood pressure and cardiac rhythm in patients with cardiovascular diseases. Kaya very important kapag may gagawin kayong procedure, syempre, is to do your history taking first. Mag-history taking muna kayo. After history taking, you do your vital signs. So, dapat complete vital signs yan. You get their heart rate, blood pressure, lalo for hypertensive patients. Then, syempre, assess nyo yung history of medication ng patients ninyo. Yan. So, use of epinephrine impregnated retraction cord is contraindicated in patients with compromised cardiovascular function, including hypertensive patients. Why? Because it causes significant amounts of epinephrine to be absorbed, especially through your gingiva. So, pwedeng magkaroon ng fluctuation sa blood pressure and heart rate yung patient nyo, especially if multiple teeth are involved for your procedure. Yan. Central acting sympatholytics which have a sedative side effect are important to the dentist. So the dentist must proceed cautiously when using anti-anxiety agents or other drugs that depresses the central nervous system kasi in combination with antihypertensives with sedative effect will result to excessive CNS depression. For example, you have your methyl-dopa, your clonidine, your guanabenzguanfacine for hypertension. So in this case, you use smaller doses. So use smaller doses compared to the usual dose. Kasi nga, you want to prevent excessive CNS depression. Kaya very important for you to take note of the drug of the patient. Yan. So for adverse effects of antihypertensives, one adverse effect of significance to your field is associated with antihypertensive medication is orthostatic or postural hypotension. Kasi syempre, di ba, yung posture ng patient pag gagawa na kayo ng procedures nyo is recline yung chair, ganyan. So after being in a supine position, many patients receiving antihypertensive therapy may be unable to compensate adequately for a sudden change in position, hence magkakaroon sila ng sudden drop in their blood pressure. Kaya pag ganito, yung patients nyo who are hypertensives under antihypertensive therapy, syempre, you consider postural or orthostatic hypotension. Kasi after ng procedure nyo, pagka tayo ng patient, baka bigla na lang matumba yung patient nyo. So, syempre, pag ganito, alalay nyo muna yung patient nyo, then hayaan nyo muna umupo yung patient. Huwag tatayo agad yung patient kasi pwede silang matumba or pwede pa silang magkaroon ng injury. So, yan yung i-prevent natin. So another adverse effect of your antihypertensive patients na important will be your sterostomia. So dun sa mga drugs nyo, take note of your drugs that causes postural hypotension, and here you have serostomia. So inhibition of salivary secretions causing dry mouth. So common in patients medicating with centrally acting antihypertensive patients, like yung na-mention natin kanina, your methyl dopa and clonidine. So, possible kasi na maka-encounter kayo ng patient complaining of serostomia, yun pala, ang maintenance medication nila is clonidine, methyl dopa, di ba? So, alam niyo yung sasabihin niyo sa patient niyo. Ayun, ba't bumabalik? Yan. So, yun lang yung important with your antihypertensive patient. So, take note yung correlations with your field. So, proceed tayo with your anti-anginal agents. So, anti-anginal agents, ginagamit siya in cases of angina pectoris. So, angina pectoris, this is a symptom of an ischemic heart disease. So, ibig sabihin ng ischemic heart disease, there is a decrease in the oxygen supply to your muscle, kaya nagkakaroon ng chest pain. So, that's your angina pectoris. So, it develops as a result of an imbalance between oxygen supply and oxygen demand of the myocardium. So, kapag nag-increase yung oxygen demand ng heart muscle mo pero decrease yung oxygen supply, it will lead to angina pectoris. So, it will lead to chest pain. Ay, bumalik na naman siya. Yeah. So, under anti-anginal agent, first you have your glyceryl trinitrate. So, glyceryl trinitrate, it prevents myosin interaction with actin, leading to relaxation. So, action is almost exclusively on the smooth muscle cells. Effect on the smooth muscle cells, both large arteries and veins, will cause relaxation. So, magre-relax yung muscles ng arteries nyo, hence, it will result to a good blood flow towards the cardiac muscle. So, here you have your isosorbide dinitrate. So, madalas itong ginagamit in patients with ischemic heart disease, your isosorbide dinitrate. So, it is a vasodilator, so it will dilate your vessels. Indication, used for acute attacks. So, acute attacks, you use it sublingually. Acute attacks of angina pectoris. But for chronic prophylaxis, to prevent angina pectoris, you use it orally. So again, syempre, pag prophylaxis lang naman, oral, para mas matagal naman yung absorption. But for rapid effect, for you during acute attacks, you use it sublingually para direct absorption. Yeah. So it is also used in cases of acute myocardial infarction, congestive heart failure, and acute left ventricular failure. So, isa pa sa madalas ginagamit is this, your isosorbide 5-mononitrate. So, madalas na ginagamit yan, your isosorbide dinitrate and your isosorbide 5-mononitrate. So, this is also a vasodilator. Indications, you use it in pulmonary hypertension, also prophylaxis for angina pectoris, and after myocardial infarction therapy. But take note, this is not recommended for acute attacks of angina. Mas ginagamit for acute attacks of angina is your isosorbide dinitrate compared to your isosorbide mononitrate. So here, pwede nyo gamitin for acute attacks sublingually, but for isosorbide 5-mononitrate, you don't use it for acute attacks of angina. So for erythritol tetranitrate, this is also a vasodilator. So indications, chronic prophylaxis for angina pectoris. So puro siya prophylaxis. So ibig sabihin na prophylaxis is to prevent the development of your angina pectoris. So para hindi ka magkaroon ng attacks of angina pectoris, you use the drug para siyang maintenance therapy. So next, you have your dipyridamole. So dipyridamole, this is a coronary dilator. So vasodilator pa rin siya, but focused on the coronaries and claimed to dilate the coronary resistance vessel. So indications, prophylaxis for coronary and cerebral thrombosis in post-heart attack and in stroke patients. So, correlations with dentistry ng mga anti-anginal drugs. Anginal attacks can be precipitated by physical or emotional stress because these situations often arise in the dental operatory. So, dentists must be aware of the symptoms and treatment of angina. So, pwede kasi kayong may patient with history of angina. Kunwari, meron naman siyang clearance dun sa physician niya. So, nag-perform kayo ng procedure but sa hindi inaasahang pangyayari, biglang nagkaroon ng anginal attack. So, dapat you are aware of the symptoms of angina and syempre how you will treat angina kahit na first aid treatment lang. Pero syempre, ang pinaka-safest pa rin during this one is to immediately bring your patient to the nearest emergency room. Kasi ang anginal attacks kasi is very deadly. So, nakakatakot to. Pwedeng biglang mag-myocardial infarction yung patient nyo sa clinic nyo. Yan. So, if a patient experiences anginal pain in the dental office, you stop the procedure. You put your patient in a semi-reclined position. Hook your patient in your BP monitor. So, check your BP and syempre your heart rate kung may pulse ox kayo to check the heart rate. So you can re-administer nitroglycerin if in pain pa rin yung patient, persistent after 3 to 5 minutes. But avoid nitroglycerin in patients who are hypotensive. Magkakaroon ng sudden drop ng blood pressure yung patient nyo. So, pwede kayong mag-initiate ng shock in your patient. So, if with no improvement, you bring your patient to the hospital. Syempre, if you don't have your nitroglycerin, best here is to bring your patient to the nearest hospital. So, the use of epinephrine in gingival retraction cord is contraindicated in patients with angina pectoris because of potential for an excessive workload on the heart. So, pag nagkaroon ka kasi ng increased workload sa heart, mag-i-increase yung demand ng heart mo for oxygen. Pag nag-decrease yung demand ng heart for oxygen, tapos ay increase yung demand ng heart for oxygen, pero decrease naman yung supply ng oxygen, magpe-precipitate ka ng anginal attack sa patient. So, gingival overgrowth and inflammation occasionally develops in patient as a result of therapy with your calcium channel blockers. So, isa sa mga side effect ng calcium channel blockers is your gingival hyperplasia, especially when taken concurrently with other agents that promote gingival enlargement like your phenytoin, cyclosporine. So, pwedeng mag-cause yan ng gingival overgrowth in your patient. So, syempre, pag na-encounter kayo ng patient with this complaint, tapos yun pala, ang maintenance therapy ng patient mo are calcium channel blockers along with other drugs, syempre, alam nyo na yung sasabihin nyo. You advise strict oral hygiene measures like your dental prophylaxis to be able to reduce the problem. Kasi syempre may mga patients hindi naman talaga nila maiiwasang gumamit ng maintenance therapy like your calcium channel blocker. So, ang maisasuggest nyo na lang sa patient nyo is to do regular dental checkups with you to prevent this one and to prevent worsening of their side effects. Kapag kaya naman ng other drug, then might as well suggest them to go to their cardiologist to change the drug. Pero pag hindi possible na i-change yung drug, edi ang gagawin nyo na lang is to do regular dental prophylaxis. Yan. So, proceed tayo with your antiarrhythmic agents. So, antiarrhythmic, ginagamit siya for patients with cardiac arrhythmias. So, cardiac arrhythmias, this is a group of disorder characterized by an abnormal cardiac rhythm, and it arises as a result of disorders of impulse formation or conduction or both. So, ibig sabihin lang ng cardiac arrhythmias, meron kang problem with the impulsing in your heart. So, kapag may problem sa electric impulses in your heart, magkakause yan ng irregular heartbeat. Kaya pag titignan nyo here sa picture, kapag normal yung electric signals mo, you will have an ECG reading of like this. So, normal sinus rhythm. So, normal yung electric impulse in your heart. Normal yung heart rate ng patient. But for patients with atrial fibrillation, magiging ganito yung itsura. So, irregular yung heartbeat. So, this is your atrial fibrillation. This is an example of a cardiac arrhythmia. Ay, bumalik na naman siya sa taas. Yan. So, when you say tachyarrhythmia, the heart rate of the patient is more than 100 beats per minute. Kasi nga, sabi natin, ang normal is 60 to 100. So, more than 100, that's tachyarrhythmia. For bradycardia, that's less than 50 to 60. Kasi nga, 60 to 100 ang normal. So, less than 60, that's bradycardia. That's already considered to be slow. So, ano yung mga drugs na ginagamit natin? So, first, you have your sodium channel blockers. So, sodium channel blockers limits the conductance of your sodium and potassium across the cell membrane. So, they interfere with depolarization and will decrease responsiveness to excitation. So, for sodium channel blockers, i-block niya yung sodium channels para makorek yung problem with the impulsing in your heart. So, under sodium channel blockers, you have your quinidine. So, quinidine, this is an alkaloid obtained from a plant. So, its sodium channel blocking property results in an increased threshold for excitability and decreased automaticity. So, indication, syempre, arrhythmias. And you have here tachycardias. Yan. So, problems with the heartbeat. So, for procainamide naman, it has quinidine-like cardiac properties. It depresses excitability of your atria and ventricles. So, contractility and conductivity are also depressed. So, para hindi masyadong excited yung electric impulse sa heart, yeah. Ay. Yan. So, indication, syempre, arrhythmias. Adverse effects, your procainamide can cause a syndrome that will resemble an SLE. SLE is your systemic lupus erythematosus. So, you read on this, systemic lupus erythematosus, para alam nyo kung ano yung itsura, kasi your procainamide will cause a syndrome similar to this. Yung mga butterfly rash sa face, yan. So, you also have your disopyramide. It will have an anticholinergic and membrane depressant property like quinidine. So, it is effective against most of your atrial and ventricular arrhythmias. Adverse effect that is important with your disopyramide is your xerostomia. Yan. So, indication, atrial and ventricular arrhythmia. So, here, under sodium channel blocker, you have your lidocaine. So, lidocaine kasi, di ba, ang action talaga niya is on your sodium channel. So, it is a sodium channel blocker. It is a local anesthetic with a rapid onset of action, but it also depresses your diastolic depolarization and automaticity. So, pwede siyang magamit in patients with arrhythmias. So, aside from being an anesthetic, it can also be used for arrhythmias. So, for your beta-adrenergic blockers, so beta blockers pa rin to. Beta blockers will also have a function in your arrhythmias. Yan. So, due to its cardiac adrenergic blockade, so indications useful in cases of sinus tachycardia. So, it can decrease the heart rate of the patient. Yan. So, for drugs prolonging action potential naman, you have your amiodarone. So, amiodarone yan, ginagamit ito, ito sa mga drug na ginagamit, kunwari, during an emergency situation. Yung isang patient, walang heart rate, hindi humihinga. So, you do your CPR. So, isa sa mga binibigay dun sa patients kapag ka-check dun sa kanyang heart rate, meron siyang arrhythmias, is to give amiodarone. Yan, amiodarone. But take note with amiodarone, kaya nga siya iode. Kasi it contains iodine. So, it contains iodine, so it can cause problems with the thyroid function. So, dapat With caution din yung pag-use ng amiodarone for patients with problems with their thyroid function, lalo for patients with hyperthyroidism. Yan, meron ding bretylium. It will have a direct action on the myocardium. So, it interferes with the neuronal release of catecholamines. Indication, syempre, you have your tachyarrhythmia, ventricular fibrillation. So, for calcium channel blockers, na-discuss din natin ito as antihypertensive. So, here, pwede rin siyang gamitin for arrhythmias. So, it inhibits calcium-mediated slow channels inward current, thus inhibiting calcium-mediated depolarization. So, indications, yan, post-SVT, supraventricular tachycardia. Yan, it controls ventricular rate and also fibrillation. So, technically used in arrhythmias. So for correlation with dentistry, patients who are being treated on a long-term basis with antiarrhythmic drugs, if under adequate control, are usually not a management problem for the dentist. So pag long-term naman nang nagtitreat yung patient nyo, okay naman yung heartbeat ng patient, and with clearance naman with their cardiologist, then no problem. Yeah, so many dentists fears the use of epinephrine in cardiac patients. So while usually not a problem in the doses used in standard dental practice, it may be necessary to also discuss with a cardiologist the use of epinephrine or other adrenergic vasoconstrictors in patients with significant arrhythmia history. So pwede ka kasing mag-trigger ng tachyarrhythmias dun sa patient. So, with proper na doses naman, it's not a problem. Pero syempre, for you to be sure, especially with patients with arrhythmia, you just ask them to get clearance with their cardiologist. If cleared by the cardiologist, then good. So most cardiac patients can easily handle 40 micrograms of epinephrine per hour without adverse effects if injected slowly after negative aspiration to be sure that the medication is not given intravascularly. So ito talaga yung dapat sure tayo na hindi natin siya nai-inject sa vessel. Siyempre pag na-inject mo siya intravascularly dun sa vessel mo, mas mabilis yung effect. Kaya dapat nag-i-inject kayo slowly. Slowly lang. Especially for cardiac patients. So, combination of epinephrine and propranolol. So, propranolol or LOL, this is a beta blocker. May lead to hypertensive reactions. So, take note